So again, this is from our expert committee on human care, bringing humanness to the bedside. What is compassion? Compassion is kindness, caring, and willingness to help others in the patient care. So I tried to find a good singular word. There were several words, things that I thought was like anukampava, karunava, or dayava. Out of this, I think I thought dayanukampava is the best word to explain compassion. In Tamil, it could be arutapam, irakkam, or karunai. So compassionate patient care, or we can call it Dayanukampita Rogi Satkaraya or Dayanukampita Rogi Surakshava. In Tamil, Karune, Mattum, Iruttam, Kudiya, Noyala, Paramaripu. It is a healthcare approach that combines emotional support with the medical treatment. So it is already discussed, clearly explained by Ganaka, and also with examples by Pamudita, and focuses the care beyond treatment. It focuses caring the whole person or the holistic care and considers their physical, emotional, social, and mental well-being. Now you saw this slide before also. As Sir William Osler said, a good physician treats the disease. With the knowledge and the skills that the patient, he has, he can treat the disease and cure the patient. But a great physician treats the patient who has the disease. So he considers about concerns about the person who has the disease and treat him with holistic care. This was discussed, and you saw the same photo in Pamudita's slides also. Now, in one side, we have truckloads of guidelines, especially in cardiology, as my interest, as well as any other disease condition, you have a guideline. So, none of these guidelines talk about empathy or compassion, and what your attitude should be towards the patient and the patient care. So if you look at this picture, I want to bring your attention, other than the comprehensive treatment given to this patient, I want to bring your attention in three things on this doctor. Look at the way he holds the patient's shoulder. The touching with concerns is a very important part in treatment. And the way he look at the patient, the eye contact and the smile he has, those are much more important perhaps than the treatment given to the patient in comforting him and improve his satisfaction. So what are the things that you should consider if you want to develop yourself and inculcate good practices to improve compassionate care? One is the way you greet the patient. When you see the patient, the smile and the greet you pay to the patient. Then demonstrating empathy. That is understanding and sharing the feelings of the patient. Like even if you have not experienced those feelings, you understand how the patient feels in that way. And your eye contact, we all discussed. The active listening, Pamudita also mentioned about it. And understanding the patient's concerns, the feelings, the beliefs, all of that. And concerns about patient's well-being and your commitment to alleviate the suffering, both the physical suffering, the pain, as well as the emotional suffering. Creating a safe environment to the patient and ensuring a patient feels secure in the setting as well as is comfortable and also feeling that there is no judgment on the patient. And the personalized care, the patients are different from one to other. And understanding and tailoring the treatment and approaches to individual needs and preferences. Right? Going above and beyond. Sometimes we have to go above or beyond the routine practices, routine patient care, and spend extra time and do extra things to the patient to improve his comforts. Cultural awareness are important. Understanding and respecting those diverse cultural backgrounds and beliefs are important. And advocacy. Once the patient has made an informed decision, we have to represent that, and represent that and make sure that those things are done. Providing comfort to the patient, of course, the communication, and that includes explaining procedures and the treatment plans clearly, using a simple language that can be understood by the patient, and also answering their questions patiently. And respecting the dignity, privacy, and the independence of the patient. So, these are few examples, very simple things that we can develop. By a doctor providing clear explanation about a medical condition. Right? Suppose someone coming with a myocardial infarction or a snake bite, what they will have is a fear of death and the excruciating pain, perhaps. So, just explaining and reassuring them will be much more important to them than your treatment. A nurse comforting a patient before major surgery, you know how horrified the patient will be. Just holding the patient's hand and comforting the patient before the anesthesia. A caregiver just engaging with a long conversation with an elderly person, because the patient is just lonely. He has no one to talk to. So just having a long chat with him is important. Right? So I just want to show you one example. This is one of my patients who is actually a foreigner living in Sri Lanka. This patient suffered a stroke, a left hemiparesis, while traveling, during an air travel. So the patient was given good treatment, and patient recovered completely. Right? On examination, there is no motor weakness or there is no demonstrable sensory loss. Although patient says, and this is how patient feels. This object, patient actually brought to me. I took a photo of it. It's a doll with clay. She has covered one part. She keeps on telling me, doctor, this is how I feel. Although there is no motor weakness, there is no sensory loss, and patient walks normally, no hemiparetic gait, patient sees that side of the body is heavy. Doctor, can you help me? There may be, the reason could be multifactorial, could be just psychosomatic, but we need to listen to the patient and address the patient's concerns. So that is how the compassionate care is, and that is how we can help the patient. So at last, I just want to show this quote by Dalai Lama. He says, I quote, "My hope is that one day formal education will pay attention to what I call education of the heart. That is the most important aspect of a training of a medical or a healthcare professional. Because with that, we can heal many patients." So, ladies and gentlemen, in summary, a summary of the whole session actually, with the symposium on human care and bringing humaneness to the bedside. So we talked about, actually Ganaka mainly talked about the patient as a fellow human being and with illness and so many other sufferers. And a very nice lecture given by Pamudita, he talked about feel your patient as a human being with illness and so many other sufferers. And compassion, help your patient to overcome the illness and so many other sufferers. Thank you very much.